Critical Thinking, narrated by Lisa Shiver. So why is critical thinking so important? Critical thinking is a key to making sound decisions. It also allows nurses to use an understanding of nursing knowledge to help set patient priorities or make decisions regarding patient care or take action. So how does the nurse organize all information so the right action can be taken? Well, in order to understand that, you have to understand the 4 essential levels of learning. The first step is knowledge. You must acquire the knowledge. Knowledge is just basic facts that you know. It's memorized information. If you use flashcards to study, you are basically obtaining knowledge. Knowledge test questions will ask you to identify factual information. Maybe the signs and symptoms of a diagnosis or a normal range of a lab value. Step 2 involves comprehension. This is where you have an actual understanding of a set of information. You're able to reason why things are so, and you may be able to identify cause and effect of a situation. Questions that test your comprehension or your understanding may ask the reasons that something has occurred or recognize an action that exemplifies information. So with understanding, it's just a little more information than it is with just a basic knowledge question. You have to use some reasoning. The third step is using application. This is where we actually use the information and understanding to make decisions related to a certain situation. For example, we may be determining what needs to happen or how will it happen. So it's going a step further than the knowledge and the understanding. Questions that are in application format may ask scenarios. It might give you patient scenarios in which you have to determine which action the nurse should implement. It may also ask what should the nurse or what could the nurse delegate to another personnel. And lastly is the analysis. This is when we use knowledge, understanding, and decision making to examine and interpret parts of a situation to create a whole. So we're pulling all of the different parts together to use analysis. Analysis questions may ask you to decide what would be your first priority based on the situation you have. Here's an example. Let's say the client's serum potassium level is, we'll pick a number 7. We know, using knowledge, that that is high because the normal range usually runs 3.5 to 5 or so. So that is high, probably the result of, we could say, acute renal failure. This is important because would be because it can cause cardiac arrhythmias. If your potassium gets high enough, it actually could cause sudden cardiac death. Therefore, I must do what? And in this case, we would need to call the physician or notify the MD. In this situation, taking action is more or less important than, let's say, AM care needed to be done. So would you call the physician first because your patient's potassium was 7? Or would you worry about the AM care that needs to be done? So let's look at this again. If the patient's serum potassium is 7, we know that is high. It's probably a result of renal failure. It is important because it could cause cardiac arrhythmias. Therefore, I must call the doctor. In this situation, taking action is more important than their AM care, which also must be done. So what was the basic knowledge? What reflects comprehension? How does the nurse apply knowledge? And what analysis is performed? Well, if you break each part down, the basic knowledge is in blue. We knew what the patient's basic serum potassium level is. But we must go past that. We need to know, well, why might this be happening? So probably the result of renal failure would be related to, we have an understanding of that knowledge. This is important because it could cause cardiac arrhythmias. Therefore, I must call the doctor. When we get to the part in green, This is looking at the analysis. We're looking at the situation as a whole and prioritizing what would be more or less important. Critical thinking test items are written at the application and analysis level. I can promise you, you won't have many nursing questions that are just testing basic knowledge. So you need to learn how to apply the information that you're learning. You must learn to practice and study skills that help prepare you to answer these kinds of questions. And just a hint that I have, a test-taking hint, study the information like you're going to have to present it or teach it to somebody else. If you learn information in your terms, in your own words, then you'll be able to retain it a lot longer. It'll stick with you and you'll be able to apply it as well.